Lycopene is the bright red pigment that gives colour to a number of fruit and vegetables. Tomatoes are the main food in Western society, and it makes up 85% of the total lycopene intake. Lycopene belongs to a large family of carotenoids, and this includes over 600 pigments. The best known are beta-carotene and lutein. We know the carotenoids are healthy, and a large body of research supports their benefits. Among all the carotenoids, lycopene carries several unique benefits. It's abundant in food, especially tomatoes. It's an antioxidant and an anti-inflammatory. It might help to prevent prostate cancer. It supports heart and brain health, and it protects the skin and the eyes. Antioxidants capture and they neutralize free radicals, which damage the tissues and contribute to numerous diseases. Lycopene is more than just another antioxidant. According to some cell studies, it might be among one of the most powerful ones. In one study on sperm cells, it preserved sperm motility and protected from oxidative damage. Free radical damage plays a role in heart disease. Antioxidants help in general, but lycopene has a unique potential among them. In an observational study of 1,379 European men, high blood levels of lycopene, but not other carotenoids, correlated with fewer heart attacks. In line with this, low lycopene blood levels were associated with heart disease in an observational study of 210 men. Other observational trials suggest higher lycopene intake might be protective against atherosclerosis, a central risk factor for heart disease and stroke. A meta-analysis of 12 studies concluded an intake of 25 milligrams of lycopene per day effectively reduced two major heart disease risk factors, the bad LDL cholesterol and high blood pressure. In another meta-analysis of 21 trials, higher tomato intake was associated with lower LDL cholesterol and improved blood vessel function. It also confirmed the benefit of the effects of the lycopene on the blood pressure. To sum it up, lycopene might protect the heart by preventing atherosclerosis and reducing cholesterol and blood pressure. Lycopene tends to accumulate in the prostate, and this might play a role in prostate cancer prevention. In an observational study on nearly 50,000 men, those with a higher lycopene intake were less likely to develop prostate cancer. The link was even stronger for a deadly type of prostate cancer. Those who ate more tomatoes had higher lycopene blood levels, and this lowered their prostate cancer risk. And once again, other carotenoids had no effect. A large analysis of 17 studies concluded increased tomato consumption is linked to 15 to 20% lower rate of prostate cancer. The connection between lycopene intake and cancer rate was weaker but still significant. The largest meta-analysis of 26 studies on over 560,000 participants confirmed an inverse association between lycopene intake and blood levels and prostate cancer. Eating tomatoes protected against digestive cancers in an observational study on almost 6,000 people. In another study on over 7,000 women, high blood levels of lycopene were associated with lower rates of breast cancer. Other carotenoids like alpha and beta-carotene lack this benefit. Dietary lycopene combined with other herbs like ginkgo improved cognition in a study on 622 elderly people. But ginkgo itself enhances cognition, making lycopene's contribution unclear. Another study paints a clearer picture. 193 healthy older people with high blood levels of lycopene had better cognitive function. The lycopene prevented early cognitive decline in rats with diabetes and Parkinson's disease. In both cases, it worked by reducing oxidative damage in the brain. In another rat study, lycopene improved depressive behavior by lowering brain inflammation. It reduced injury to the hippocampus, the brain's hub for memory and emotion. In a study on 22 people, eating 40 grams of tomato paste, roughly 12 milligrams of lycopene every day for 10 weeks, reduced sunburn and skin damage by 40%. According to another research group, tomato juice lowers sunburn by almost 50%, but lycopene only accounts for half of the effect. Eating more tomato-based products might reduce sunburn. Tomatoes are rich in lycopene and other skin protective compounds. People with the age-related vision disease macular degeneration have lower levels of lycopene. We know numerous other carotenoids also improve eyesight, while lycopene might do the same. In a clinical trial on 102 patients, lycopene supplements reduced the symptoms of chronic pelvic pain syndrome. It relieved diabetic nerve pain in rats and mice by reducing inflammatory compounds like TNF-alpha. According to a study on 33 postmenopausal women, those with higher blood lycopene levels from a dietary intake had less oxidative bone damage. The researchers didn't measure its effect on bone composition though. In a rat study, a lycopene-rich diet increased bone strength better than a typical diet. Additionally, lycopene reduced bone cell death in test tubes. The downsides of lycopene are negligible when consumed in moderate amounts. However, too much lycopene may cause certain health risks. Excess lycopene intake may cause lycopene-dermia or lycopenemia, conditions where the lycopene literally starts to turn your skin red like a tomato. It might also cause digestive upset and pain. According to clinical reports, you need to ingest a lot of tomatoes regularly to trigger it. To trigger this side effect, you'd need to eat 5 tomatoes every day for roughly 3 years. Anecdotally, excessive lycopene intake can cause a number of stomach issues, including diarrhea, nausea, stomach cramps, gas, and even vomiting. However, many of these side effects may be from the other plant compounds in lycopene-rich foods that trigger the gut reactions in sensitive people. Up to 75 milligrams per day of lycopene is considered safe. The dose could even be up to 270 milligrams per day without the risk of side effects, according to observational studies. Children, pregnant women, and breastfeeding women should avoid lycopene supplements due to the lack of safety data. Eating moderate amounts of lycopene-rich foods is safe, however. Increased lycopene intake might protect women against high blood pressure in pregnancy, known as preeclampsia. For a dosage, lycopene supplements can be 60 milligrams per day for 3 months, and this improved various measures of health. Supplements are mostly sold in capsules of 10 to 25 milligrams of lycopene each. Lycopene is a pigment that colors tomatoes bright red. It's a natural plant anti-inflammatory and a strong antioxidant. Increasing the lycopene intake, either through food or supplements, might protect against prostate cancer and heart disease, while the evidence for the other benefits is insufficient. If you don't tolerate tomatoes, you can consider getting a supplement with at least 10 milligrams of lycopene per capsule. For more on herbs, supplements, and natural treatment plans, check out my website.